Well, at Oticon, we've recently moved into a brand new 162,000 square foot facility. And the beauty is that we were able to do that and design it based on our 100 years of product design and manufacturing experience. So we were able to lay the facility out, taking advantage of that to optimize productivity and efficiency and really streamline the workflow. In addition to that, I think this expansion has allowed us growth for the future. So we were able to put the infrastructures in place to keep pace with the growing demand. It also enabled us to increase and upgrade all of our manufacturing equipment. And part of that manufacturing equipment consists of the SLA process. Now, for those that don't know what SLA is, it's called stereolithography apparatus. It's kind of a tongue twister, but what it means, it's really a great ability to take advantage of the new technology to create shells. We're able to double capacity and at the same time make a much more cosmetically attractive, smoother finish, comfortable fit product for the custom side of the business. Oticon produces a variety of BTE instruments and custom instruments to the marketplace. With the introduction of the invisible in-the-canal product Antigua, there is a growing custom product demand out there. With today's advances in technology, as well as the optimization in the design of making the product, we can make it smaller, comfortable fit, and the hearing care professional can fit a wide variety of hearing losses. And it goes beyond technology. Just because you have technology will not ensure you have a good performing product. It takes people, and people are a key foundation within Oticon. So it's a combination of the technology and how to use it, using the people, using their understanding of what's important to make a good product. Put those two together. That's called success. I think it's important for the hearing care professional to understand, with this new technology, they still have a key role to play in the quality of the impression that they provide. And I'm often asked is, what does it take in terms of an impression to make a good quality product? And it's really fairly simple. It's one of consistency. Is when an impression comes in, does it go beyond the second bend? Ideally, 2 millimeters beyond the second bend, full canal. Use that otoblock. I think that's important so that we can get a full, good size impression, including the concha, because the concha is also very important for a manufacturer because that's going to determine our locking points. Once we get that impression, the process we go through is we scan it. When I say scan, what we do is we make, through 2 cameras, we take what's called a digital point cloud. That's roughly 100,000 measurements in 2 to 3 minutes. So we create an exact replica of the impression that we get in. So after we do the scanning, we create a 3D image of that impression. Again, an exact replica. Now we print it. Now when we print it, we use the new technology. And again, that new technology makes it very consistent. We can have a very consistent product. So again, it's incumbent that we get a good quality impression. If we have that, it goes through the process of the shell making, it goes to our assembly floor, and then the technicians will take those components, put those components into the product for a product that's consistent, comfortable, as small a size as possible. So hopefully when you open that box, when you get that delivery, not only you're happy, but your patient will be happy as well. The question that comes up is, what happens if we don't have a good impression? The hearing care professional might think with the advances in technology that the quality of the impression may not be important as it used to be. And it's actually the opposite. Because now, with the advances in technology, we are making an exact replica of that impression. And it's even more incumbent on them today, particularly with the smaller the products, the deeper in the canal that we go. So it's very important that we understand the anatomy. And we do that through the interpretation of the impression. It's a teamwork to make a good fit. And the hearing care professional has the advantage of having the client right in front of them. We as a manufacturer, on the other hand, rely on the impression. So any information that hearing care professional can relate to the manufacturer. For example, let's say it's a first-time user. That would help us in the tapering process of the canal to make it easy for insertion, perhaps a more comfortable fit. On the other hand, if you know you had a previous issue with the user, like slippage because of a straight canal, minimal locking points, let us know. And let us know if it'd be okay to, for instance, add a canal lock. So these are the little tips that you can help the manufacturer with. There's a reason why they call them custom products, and that's because no two ears are alike. What does it take? It takes attention to detail. It takes a dedicated staff reading the instructions, and it's also that teamwork element, communication with the hearing care professional as well as the manufacturer working together to ensure a good fit that's right the first time.